Rolling.
In 2006, according to the Centers for Disease and Prevention, a division of the U.S. government, 33% of school-age kids are overweight. Many schools are serving substandard lunches, which are contributing to the obesity of children they serve daily. If you have children who attend public school or are a grandparent, or even if you don't have any children at all, this topic will affect you. Through research, I have gained knowledge about the effects of childhood obesity on society and how school lunches affect this problem. Throughout the speech, I will discuss why we need to change the foods that children are consuming while at school, the plan to start an incentive to make this happen, and the practicality of this situation. You may be thinking, why do we need to worry about what our kids eat now? Or the foods that the schools provide is suffice and healthy enough, so why should we make changes? There's a need to ensure that schools are following nutritional standards as stated in the food pyramid. According to the CDC, the level of obesity in children rose by 11% between the years of 1980 to 2006. The CDC states in the year of 2005 to 2006, children in the age range of 12 to 19 who were overweight were 18%, and children in the age range of 6 to 11 were 15%. Children in the age range of 6 to 18 years of age spend approximately 9 months of the year in school. These children are eating at least 1 meal a day at school. The types of lunches mentioned by the CDC include meals containing pizza, hamburgers, french fries, as well as other deep-fried grease-filled foods. Schools do offer a healthy choice, although the main items they serve daily are very unhealthy. I took time to look up the school lunch menu for the elementary I attended in Cloverdale, Indiana. They do give the option of a chef salad every day, but what kid is going to choose a salad over a burger and fries? Not many. The areas that are highlighted on this menu are the unhealthy things. As you can see, there aren't very many healthy choices. Children who eat these items daily have a higher chance of being overweight as adults. Children who are obese are more likely to continue being obese as adults, as stated by the CDC. As witnessed on the television show The Biggest Loser, obese adults earn an average of $7,000 less than their peers. Adults who spend their lives with weight issues are more likely to experience poor self-esteem and depression. On the television show The Biggest Loser, experts stated that in the United States, $147 billion are spent each year on obesity-related medical issues. Some related medical issues are hypertension, heart attacks, diabetes, as well as a reduced capacity to recover from serious injuries and surgeries. In order for students to receive the nutritious meals they need at school, the government needs to provide a specific program towards that goal. The government needs to implement a nationwide program so that schools who can prove that they are serving nutritional and healthy meals daily for their students, that school will receive an incentive for their cafeteria budgets. Many schools struggle to independently support their cafeteria budgets. According to the state statistics, Indiana has 35.3% of its students on free or reduced lunch programs. This burdens the cafeteria budget as the families of these students are unable to pay for their own breakfast or lunches. Due to the economy being in a slump, states are struggling to pay for the necessities of school needs. It is more expensive to provide more nutritious lunches, which places another burden on an already overburdened system. Through the monetary incentive, the government would provide schools could improve their capability to provide more nutritious meals. Schools could purchase fresh ingredients for their lunches. Schools could also educate the cafeteria staff on creative ways to get kids to eat more nutritious foods. As the government has already provided the information needed to eat in a healthy way, it is easier for schools to implement a healthy eating program. The new food pyramid created by the Health Department of the U.S. government gives specific guidelines on what Americans need to eat in order to be healthy. The U.S. food pyramid is a visual representation of what types of food we should eat and the amounts we should consume. It specifically states that consumers should eat more whole grains and fewer refined foods. It also states that consumers should also eat more fruits, vegetables, and lean meat. And here's the food pyramid. Unless the government intervenes and helps to provide children with healthy school lunches, we will continue to see a rise in the numbers of children who are considered either overweight or obese. Children who have weight issues have several problems to overcome. Some of these problems are physical and some are mental. Children who are not taught how to eat in a healthy way may never change their habits. These children will grow to obese adults. The costs of obesity to Americans are high, and it is a disease that does not single out income levels, geographic areas, nor racial or gender boundaries. The costs of obesity are monetary and health related. As stated previously, $147 billion are spent each year for health care issues caused by obesity. The cost of obesity is high. It is something that we can no longer ignore. People are affected by obesity more than by cancer. As stated on The Biggest Loser, we spend $97 billion each year on cancer-related medical issues. That means that we spend $50 billion more dollars each year on obesity. Therefore, it is in the best interest of everyone in the U.S. to support a government program to promote healthy school lunches. Imagine a young child sitting alone on the playground. The child is overweight and cannot move the way his peers do. Imagine a young teenage girl sitting alone at home on the night of her prom because no one wanted to take the fat girl to prom. These scenarios are emotional and they happen every day. Childhood obesity is painful and unhealthy. It is a disease that can be and should be eliminated from the face of the earth.